Well, thank you. I'm glad to be here this evening with you. This topic tonight is a tremendous topic. I think that asthma is it's just a choker. If it's looking at this picture here of the lungs and the chain around them, that's exactly how I think patients feel. I don't have asthma myself, but to not be able to breathe well and feel that restriction, it would just be something. My name is Troy Giles. I'm a chiropractic physician. I've specialized in natural being and well-being and coaching people and other doctors as well how to coach other patients in wellness. I've been a practice for 22 years here in Bountiful, Utah, and I just love practice. So tonight now we'll be discussing asthma. So just a few of the symptoms. Asthma from the Greek word means panting. So you think about asthmatics, that's what they're like. There's just a shallow, because they can't get breath in or out. Generally, they can get it in easier than they can out. But as we'll discuss the various reasons for asthma tonight, basically there's an inflammatory state where the walls of the bronchial become thickened, and also there's an extra production of mucus, which we'll discuss as toxins coming many times from leaky gut syndrome, where it's overloading the liver. The liver then shunts toxins to the kidney and the lungs and the skin, wherever else it can, to get the toxins out of the system. So I find as I work with the adrenal glands and the leaky gut syndrome that we can clear up asthma. So asthma is one of the most misunderstood conditions. It's, basically we give bronchial inhalers, long-lasting corticosteroids to help diminish the inflammation. But the inflammatory state is what we're trying to do in the whole system, is diminish inflammation, not just in the lung, but in the gut and in every other tissue that we can. It's defined as a chronic inflammation of the airways, causes a constriction of the bronchial and smaller air ducts of the lung. It can also be from an increased production of mucus. So that increased production of mucus, as I'll discuss, I really feel that it's from the leaky gut. So just a few statistics. In 2001, 1 in 14 had asthma. Now, in 2010, it's 1 in 12. And 1 in 10 in children in 2009. 3 out of 5 children with asthma had 1 or more asthma attacks within 12 months. So it's, it just happens. It's happened. So many of us have this. Asthma, it's usually higher among children than in adults. And again, I think it's probably because the amount of antibiotics we give the children. They've always got a runny nose many times because they're allergic to wheat or to milk. Their immune systems aren't quite as strong yet as well. But look at this though. So asthma costs the U.S. $56 billion in medical costs. This was in 2007. $56 billion. Lost school, work, early deaths. Now in 2010, 3,404 people died from asthma. And you think, goodness sakes, if we had a train wreck or we had a downed airplane and 350 people lost their lives, we would just go nuts. We do every time there's a plane wreck. But here, 3,404 people in 2010 died of asthma. So it's something. It's just amazing. So adults with asthma in 2009, it's interesting. You can kind of see greater than 9% is a darker color, and it kind of comes like a swath. But it's interesting that there's quite a bit more in the Northeast than there is throughout the rest of the states. Youth with asthma, so that greater than 500,000. California, Texas. I can understand California. It's there's a lot of area that has a lot of pollution. But that's just some interesting statistics there. Now, common asthma symptoms: coughing, especially at night, with exercise or with laughing. Because you think about it, when you're laughing hard or you're exercising, you're breathing in and out through the bronchial tubes, and they're already irritated. It's already pink and inflamed. And now as that air is moving in and out more quickly, that's a problem. So coughing, especially at night, think about that. When you're laying down, you're going to have more pressure in the lungs. There's going to be more pooling of fluids. So the trouble with breathing is shortness of breath. And the chest feels tight, pressure, and oftentimes painful. And then, of course, the wheezing. But not everyone has the same symptoms the same way, and they may vary from one attack to another. So some attacks aren't caused by the same thing. It might be that you've been outside breathing bad air. Here in Utah and along the Wasatch Front where I live, we'll get these bad air inversions where cold air is trapped in the bottom of the valley and hot, warmer air is above. So the high pressure keeps that smog and junk down in the valley here. And a couple of years ago, we even had worse air than in Beijing, China, for a couple of weeks during our inversion time in the winter. So inversions are very important, but they're not always. These symptoms aren't always caused by the same thing because there's many causes. So that's something to think about. The commonly believed causes, though, asthma is generally believed to be caused by triggers such as airborne allergens. We talked about the molds and the danders and things that are in the air, respiratory infections, common colds, physical activities, the exercise, cold air, so forth, air pollutants, smog chemicals, medications, beta blockers, aspirin, ibuprofen, naproxen, strong emotions. When you are uptight and stressed, you have the need for more adrenaline, and adrenaline many times wears out. That adrenaline, we don't have enough of it because we're constantly reaching into our reserves of adrenal function. So that's why those emotions can cause extra pressure on the adrenal glands. Without the adrenal glands producing adrenaline, it's a natural anti-inflammatory and a bronchial dilator. So we run out, basically. Sulfites and food preservatives, gastroesophageal reflux. So this is a big one. This is a lot of the times people with GERD or with hiatal hernias. It can reflux through and then come up and burn the area, and come up and basically burn the esophagus or the trachea and all the way down into the lung, up from the esophagus. And then the menstrual cycle in some women can cause it as well. I think that's, again, probably just because there's so much pressure on that during the menstruation time. So in my office, I find that the asthma is very much associated with leaky gut syndrome. And so leaky gut syndrome is created by antibiotics and other things. So these unwanted particles in the leaky gut can get into the blood supply. They can actually pass through this gut, which should be semi-permeable here. This is letting only certain things through. Over here with leaky gut, now we're allowing large proteins, large toxins to come through. And those then will be shunted, like I was mentioning before, overloading the liver, the kidney, the skin, and the spleen. And basically you're getting it up into the lung. Again, the skin is the largest detoxifying organ in the body. So it'll shunt to the skin, but it'll go everywhere that it can, and many times goes to the lung. So when the liver is overloaded, it will try to expel toxins in other places, including the lungs. So the bronchial and lung irritation increased by allergens will create excess mucus as well. So you mix leaky gut with these other allergens issues. Now we've really irritated the lung, and now you've got that increased inflammation, swelling, and constriction. Dairy is a big issue, and I'm sure a lot of you have noticed treating your patients that as you get rid of dairy, that their asthma diminishes. If you think about it, asthma or milk, it has 50 of the 70 phenols. A phenol is a 6-carbon ring. It has each of those 6 carbons are in a certain position. So let's say you have a double bonded carbon off of the number 1 protein. That might smell like a skunk. If you have a double bonded off of number 5, it might smell like a rose. So those phenols are what create allergic reactions. So milk has 50 of the 70. That's amazing. So you think about it, cows are eating stuff off the ground, they're chewing on the fence posts, they're, all those kind of things. So we get rid of the milk, we get rid of a lot of the phenols, and then that clears up the overall inflammation in the body, not just in the lung, not just in the bronchial, but throughout the system. So I always tell patients, if you can, get off of milk, especially if you have asthma. Next, we'll discuss the layers of infection. So many layers of infection can get into the system and transmutate, either from the gut or they're breathed in. So now you get viruses and parasites and bacteria and whatever that can be in the sinuses and down into the bronchial. So these infections cause the lung and bronchial tissue to diminish in function. Removing layers of infection will reduce asthma and increase the immune system. So if you think about fungus is a very common one that we have through our sinuses. I think it can even get into the trachea and bronchial because they're moist. I think chronic mold spores and things as well can get into the system, into the bronchial. And it creates it to where now you've got just an irritated state all the time. So let's say you have a 5 or 10% count of bacteria and fungus throughout the bronchial and sinus and trachea. And now you breathe in allergens in the form of mold or in the form of pollens can now land on that previously irritated area, and that creates the inflammatory state. So mast cells are released. This is a great look of a mast cell. Mast cells are released, which create more mucus production, tearing and watering of the eyes, so forth. But those mast cells are part of the immune response. So if we can get rid of the infections, the layers of infection, I'm not talking about huge, massive acute infections, but chronic layers of infection. If we can get rid of those layers, now we're starting to talk about a much stronger tissue through the bronchial system. So again, repairing the gut will diminish toxic loads in the system. As toxicity is reduced, so will asthma. That's what I found within my own practice. So determining the layers of infection, we've discussed in previous seminars. Bac-to-X for bacteria, Meta-X for metals. Microcyte is for microparasite, those that need to be seen with a microscope. Paramac is anything from the size of a head of a pin to a 6-foot-long tapeworm. That's what kills that. Fungex is very common in any area where there's moist tissue. So we're talking about the digestive tract and the respiratory tract. And then ViroX for virus. So these are what support the body's ability to fight infection itself. We also want to support the organs involved as well as fighting layers of infection. So we're going to want to support, in this case, the lung and the bronchial tube. Or any layer, wherever you find that layer, we want to support the organ where the layer is. So in my practice, I work a lot of layer of infection. It's just something that is important, and I think that our bodies, because of the antibiotics we've taken and other drugs and so forth, we're unable to get rid of all of it completely, which will leave that layer. So the key treatment formulas, we're talking about leaky gut syndrome, so we want to work with Coltrax to repair that tissue, make it strong. The Leptera to strengthen the overall digestive system by the digestive enzymes in it. The good bacteria. So Leptera is just a very nice meal replacement drink. I drink it every morning, and with some almonds and dried fruit and dried nuts, it's a tremendous morning start for me. It has basically everything you need. It has amino acids in it. So these two, the Coltrax and Leptera, really work well with repairing the system. One that I don't have here is Digesta, again helping to digest more effectively the foods. Because we want to, when we're talking about asthma, we want to really think about working on the digestive tract. The Permalung is supporting the bronchial, the alveoli in the lungs. It supports air exchange, gas exchange. It just supports and repairs the lung and bronchial area. Kidney Clear and Liver G, because we're trying to get rid of toxin, so we want to support those two, the liver and the kidney, because they're the ones that are going to be relieving and expelling most of the toxins that are being shunted by the toxic liver. So we want to work with the liver, the kidney, the lung. And then the Toxex supports the chelation. Again, chelating is bringing small molecules to become congealed or conglomerated to become larger molecules, and ultimately getting caught in the kidney and liver net to be excreted. So I always use the Toxex. Whenever I'm working on a layer of infection, we use Toxex to get rid of those toxins. And I usually use it at one capsule of Toxex going along with the one capsule of whatever layer of infection we're fighting. So you're talking about the layers of infection. We're talking about supporting the colon, Leptera with the colon, the Permalung, the Kidney Clear, the Liver G, and usually I'll go one capsule 4 times a day. That's a good amount when you're fighting this kind of issue. You use 2 scoops per 16 ounces of water for the Leptera, And again, one capsule 4 times a day for that specific layer of infection. And I would suggest, I actually, asthma itself, I don't know that there's one type of layer of infection that's more important than any other. Where with ADD and ADHD and so forth, you're thinking about fungus. I think with asthma, there's just all of them, all the layers of infection can contribute here. So make sure you're using kinesiology to determine what layer of infection that the patient might have. It's very difficult to do this with medical intervention to find out what the infection is. You might pick up a real acute infection, but you're not going to see the layers of infection with our lab work. This has to be done through kinesiology or an electrodermal screening. Any of those techniques will be effective. So that's how I treat asthma.